All right, YouTube, for my Healthcare-Edu students or anyone, this pertains to the state of Massachusetts. My name is Stephanie. I have a school here at Healthcare-Edu in Brockton, Massachusetts, but I am actually going to go over the Prometrics skills checklist. So this video is going to be an introduction to the checklist. If you are the state of Massachusetts and you are going to do the nursing assistant, so the CNA, Certified Nursing Assistant state exam, they're going to ask you in the skill component 3 skills, and there's a checklist that these 3 skills will come from one of the 23 skills listed on the checklist. So I'm actually going to show you that, and I'm actually just going to show you the Prometrics website where you would enroll. Obviously, Healthcare-Edu students will get more information and your certificate and things like that. But the Prometrics website, any school you graduated from, and discuss how you enroll and such. Okay, so let's go over the checklist. Don't forget to like and subscribe and share the video. And actually, what I will do too, after I do the generic ones, I will have short videos with each skill, kind of the items that you need to bring in, like the supplies that you need to gather, because when you go to the regional test site, to pass the skills, you need to gather the supplies. And so I'll do a video, quick little video on each of the supplies that you need to gather. All right. And then you can see my other videos there. So let me share my screen here. And let's go over this. So this is the Prometrics clinical skills test checklist, and you are able to get that there on their website, I believe. But my students have it. I think the CNA school that you go to, they'll be able to give you the list. All right. So some things to highlight here, that there are 22 skills that are part of the skills checklist. I won't read this off to you. You have knowledge, and people have been asking me to put up knowledge videos, which I will do to review. But right now we're talking about skills. So this is things you can read at your own leisure. And basically what these questions are, and I want to make sure that it's clear that you understand, it is not that it's a step-by-step for the skill. It's actually what the evaluator is looking for to make sure that you did that part in order to pass you on that skill. All right. So hand washing will be an indirect skill. They'll never say to do that, but prior to starting the skill, you are to wash your hands. And again, take a look at my hand washing video. We talk about indirect skills, and then let's go over each here. And I'll do a little mini video for each of these skills, but you have ambulate the resident using a transfer gait belt. So what I would do here, I think I have my ambulation video up. It says if the role is going to be played by a resident or by a mannequin. So you want to make sure that you know how to use your gait belt and your cues. There's assist resident meeting the use of bedpan. You want to make sure you wear gloves with this. And again, they're saying, did you check, did you greet the patient? Did you do your introductions and all of that? And so you can watch the videos. So you have change bed linens, you have change resident position to a supported sideline position. Role of the resident played by a person. They'll tell you when the role will be played by a mannequin. So just a resident who has a weak arm, that role is played by a mannequin. All right, empty contents. You definitely have to wear gloves with this because this has to do with urine output. What else do we have here? Feed a resident that's sitting in the chair. So all of these skills, you want to make sure that you know. Record a radial pulse. You have to be plus or minus 4. Respiratory rate, okay? Respiratory rate. Provide catheter care to someone with the indwelling catheter. You'd have to make sure you have gloves because that has to deal with urine. Provide foot care to someone sitting in the chair, resident who has denture care. What else? We have perineal care. That's the roles played by a mannequin. Partial bed bath with a back rub played by a mannequin. And I have that video up. You have hand and nail care. Range of motion. So there's 3 range of motions here of the elbow and wrist, of the one shoulder, of the one hip, knee, and ankle. and then ambulate with the wheelchair. What I always point out here, it's a pivot technique. So you have to make sure you pivot that. So you'll get 3 skills out of those. So that's how Prometrics is going to do the skills component. Okay. And so what I have my students do, you get your hands on this checklist. We write down all of the supplies, which I'll post another video, kind of notes, whatever you don't want to forget or remember. We highlight certain things. And it becomes like your template. Someone actually took all of these and wrote out little narrative, what they would say, because remember, they want you to communicate with patients, and wrote out a little script, okay? So that can be a little time intensive, but obviously it's less time than like not passing the exam and having to keep doing it. So you want to put in that work so that whatever skills they give you, you're able to pass. Another thing that students have been asking me for, if you look up here in my upper, let me get my little annotation here. It's my spotlight. If you look up here in the upper left, you have Prometrics. This is for the Massachusetts, prometric.com/nurse/aide/MA. All right, again, this is for the state of Massachusetts. I know that I'm on YouTube, but there are, you know, Prometrics would have, if you're in a different state, they would have their own page, okay? So if you need to call them, this is the number here, 1-800-722-2594. What you're going to do is that you're gonna scroll down to candidate resources. They have a list of test centers. And again, for the state of Massachusetts, we're dealing with, and Healthcare-Edu is on there for Brockton. And so what is this? 7 test centers, right? Regional test centers. And then most people end up doing an online application. So you click online application. Now, I'm not going to do it because I'm not doing it, but you would register a new user, go through that process. One thing that's big that students don't realize is that it lets you, when you do the application, it's going to let you select one of the test centers. So anyone based on your geographical location that you want to select. And then it says to upload supporting documents. Your supporting documents is a copy of your nursing assistant training certificate. So where you went to school, because they want to make sure it's from an approved DPH school. Healthcare-Edu is. Now on my certificate, I put a program code on the bottom, which I won't say here because it's out loud on YouTube. But I put my code on there. And so whatever code corresponds with your school, that's the program code. So for my students watching, it's the 4-letter code and not the license number. So whatever your school's program code you input, you're going to select regional testing site. And that's if you're going to pick one of those locations. Some schools do their own in-facility testing. So you could connect with your school. And then after that, it doesn't allow you to pick a date right then and there. I don't know if that'll change in the future. So this video is as of March 2022, but as of March 2022, March 2nd, it doesn't allow you to pick a date. So when you upload your supporting documents and answer all those questions and submit everything, they say they'll get back to you. So that's it in a nutshell. Another thing I did want to point out to you, there's renewal reciprocity. Of course, if these are, oh, here's the clinical skills checklist. So the clinical skills checklist I just went over, it's here. There are other important forms that you should go through. Again, to my students, I send them all this in an email, but this is where you find it to anyone that's on YouTube. And then they have, no, they have a practice test, and I'm trying to find where it is. It's somewhere on this site. It's a practice exam, and they charge, oh, here, take a practice exam where my cursor is. And they charge, for the written, there's 3 variations, you know, $15 each, or if you want all, you could do $35. Okay. And again, there is one that I've been telling my students about, an app called CNA Genie. I don't think I could write it anywhere here. Maybe I can. Let's see if I turn this off. I'll just write it. Obviously, CNA Genie is not linked with Prometrics. It's just information on that students have been sharing. CNA Genie is not affiliated with Prometrics at all. But I've been telling my students there's some free tests on there before you get to the paid ones, okay? So I hope that that was helpful to go through. And just to give you a heads up, people have been waiting like about 2 weeks to hear back on a test date, okay? So that's outside of the school's control. All right, take care.